Have you ever wondered how people knew they were pregnant thousands of years before pharmacies, hospitals, and pregnancy test kits? Imagine living in ancient Egypt. You miss your monthly cycle, you begin feeling different. But there are no doctors with ultrasound machines, no laboratory blood tests, not even a plastic pregnancy test. So how would you know? Believe it or not, people have been trying to answer that question for over 3,000 years. Some of their methods sound almost unbelievable. They used wheat. They used barley. Some studied the color of urine. Others believed dreams could reveal pregnancy. And for several decades in the 20th century, doctors actually used live frogs. Surprisingly, some of these methods were far more accurate than you might expect. So today, let's travel through history and discover the fascinating evolution of pregnancy testing. The story begins in one of the world's oldest civilizations. One of the oldest known pregnancy tests comes from ancient Egypt around 1350 BC. The method was remarkably simple. A woman would urinate on two separate bags of seeds. One contained barley, the other contained wheat. The Egyptians believed that if neither seed had sprouted, the woman was probably not pregnant. But if the seeds began to grow, they believed she was expecting a child. It didn't stop there. According to ancient medical writings, barley supposedly predicted a boy, while wheat predicted a girl. Today, we know that part wasn't true. But here's the surprising part. In the 1960s, scientists repeated the experiment. They discovered that urine from pregnant women sometimes encouraged seeds to sprout more quickly than urine from women who were not pregnant. It certainly wasn't reliable enough to replace modern medicine, but it suggests the Egyptians may have accidentally stumbled onto a biological effect thousands of years before hormones were even discovered. For an ancient civilization, that was remarkably observant. As civilizations advanced, so did their ideas. Doctors in ancient Greece and later Rome often relied on careful observation. One of their favorite clues was urine. Physicians believed the appearance of urine revealed hidden information about the body, its color, its smell, its thickness. Sometimes they even mixed urine with other substances, hoping to see a reaction. Of course, many of these methods had no scientific basis, but without microscopes or laboratory equipment, doctors worked with the tools they had. Medicine was still developing. Observation was often the only option. By the Middle Ages, pregnancy diagnosis became a strange mixture of medicine and superstition. Some practitioners became famous simply for examining urine. They were sometimes called piss prophets. People believed these individuals could determine pregnancy just by looking at a flask of urine. Others relied on folklore. Some believed certain foods would reveal pregnancy. Others claimed dreams carried hidden messages. Many of these ideas were completely unreliable, but they showed just how desperately people wanted answers. For centuries, no one truly understood what caused pregnancy, and no one knew exactly what to look for. That was about to change. Everything changed during the 20th century. Scientists discovered that pregnant women produce a unique hormone called human chorionic gonadotropin, or HCG. This hormone appears shortly after pregnancy begins. If doctors could detect HCG, they could diagnose pregnancy with remarkable accuracy. The challenge was simple. How could they detect such tiny amounts of the hormone before modern laboratory technology existed? The answer came from an unexpected place. A frog. In the 1930s, British scientist Lancelot Hogben made an incredible discovery. He found that female African clawed frogs responded to HCG. Doctors injected a small amount of a woman's urine beneath the frog's skin. If the urine contained HCG, the frog laid eggs within about 8 to 12 hours. No eggs usually meant no pregnancy. It sounds unbelievable today, but hospitals around the world adopted the method. The frogs became living pregnancy detectors. Unlike many earlier methods, this one was based on biology, not superstition. Scientists didn't stop there. During the 1940s, another technique appeared. Instead of female frogs, doctors used male frogs. This became known as the Galli-Mainini test. After receiving a small injection of urine from a pregnant woman, the male frog released sperm within just a few hours. Doctors examined a sample under a microscope. If sperm were present, the woman was considered pregnant. The result came much faster than the earlier frog test. For many hospitals, it became an invaluable diagnostic tool. You might be wondering, why frogs? Why not another animal? Certain frog species are extremely sensitive to HCG. The hormone triggered predictable biological responses that made the tests surprisingly accurate for their time. Another advantage was that the frogs usually survived the procedure. They could often be used again after a recovery period. For decades, thousands of frogs quietly assisted doctors around the world. But there was an unintended consequence. African clawed frogs were transported across continents to supply laboratories. Many scientists now believe this worldwide movement helped spread a deadly amphibian fungus called chytridiomycosis. The disease has devastated frog populations around the world. A medical breakthrough may have accidentally contributed to one of the largest wildlife crises in modern history. History often reminds us that scientific progress can have unexpected consequences. By the 1960s and 1970s, everything changed again. Scientists developed laboratory tests that could detect HCG directly. Soon afterward came the home pregnancy tests we know today. No frogs, no seed experiments, no guesswork. Just a small test strip capable of detecting pregnancy within minutes. Something that once required animals, laboratories, and trained specialists now fits in the palm of your hand. The history of pregnancy testing is a story of curiosity, observation, experimentation, and scientific progress. From wheat fields in ancient Egypt, to urine flasks in medieval Europe, to living frogs in 20th century laboratories, humanity never stopped searching for better answers. The next time you see a modern pregnancy test, remember that it represents more than convenience. It represents thousands of years of discovery, a journey from ancient traditions to modern science. If you enjoyed learning about this fascinating piece of medical history, don't forget to subscribe for more stories where history, science, and medicine come together. And tell us in the comments, which pregnancy test surprised you the most?